are using Grey's Anatomy for Students. It should be available in the bookstore or on Amazon. I know the bookstore tries to give you the best deal they possibly can, even with used books, so they encourage me to encourage you to get your textbooks there. We'll be using it pretty heavily, so I recommend getting that. We also have another textbook. It's an anatomy atlas by Gilroy, and the information's on your syllabus. I have found it to be excellent so far. I really like it, so I encourage you to get that too. It's a great resource as you're going into practice too. If you're like, oh shoot, I don't remember this particular aspect of anatomy, go back through. It's a great tool to be able to go back and refresh your knowledge. All right, so we're going to start off with just some overview. Just to remind you a few things that you should have taken in A&P. First of all, we'll talk about just our approach to anatomy. So this class will be studying through the regional approach. So basically, we're just going to take each region of the body, so say the thorax, or the abdomen, or the pelvis, legs, whatever, and just studying them as a unit. And one of my goals is to not only give you a good comprehensive understanding of anatomy there, but really to help you connect that. Because the point of anatomy is not just to memorize a bunch of long, crazy Latin names and try to remember which structure they go to based on weird anatomical shapes that they have, or what it looks like on a model, or on the particular cadavers that we are studying. The whole point of anatomy is to understand from a very basic structural level how this amazing 3D thing we call the human body is put together, and how that structure makes it function the way it does. So that's why then we want to keep such a close connection between my class and your medical physiology class with Dr. Crouch, because it's an integrated whole. The way the body is put together is going to allow for the physiological functions that take place. And so if you're not getting a holistic view of that through this semester, if you're starting to put this idea of a 3D human body and all the different parts in it together, if that's not coming to you, come talk to me and let's work on some strategies to help you start integrating and synthesizing that material a lot more. Because as a clinician, that idea is going to help you a lot more than knowing every single one of the anatomical terms, cold, and where they happen to be on what we're going to be examining on. So know where they would be on a live human body, how it would look. Try to get beyond just what you have to do to pass this class and really understand how a human body is put together. All right, so an example of regional anatomy, study region anatomy. So we'll just anatomical structure of some of the systems in the shoulder. So we've got the deltoid muscle here, and the underlying bone structure that's supporting it, so the clavicle, the acromion, and the deltoid, and the scapula here, providing the structure. And then the innervation here, so we've got the brachial plexus, axillary nerve, a lot more, I don't need to go through all of them. But you can see how this is a functional unit right here. It allows that functional unit, allows the shoulder to move, and just the amazing amount of mobility and dexterity with just these few things. So we can look at it and just understand the structure and say, okay, it makes sense, good. Now let's find out what would happen when things go wrong. So in addition to just learning from diagrams and pictures and stuff like that, we're also going to be learning from imaging technology. So this is a X-ray image here, and shows a normal humeral head with the epiphysis, the growth plate. So this is an area of cartilage between the head and the shaft of the humerus, where a lot of the growth happens in a younger individual, and they'll get then sealed together as bones mature. But the point is, this is what it looks normally, and then we want to identify what it looks like when something's not normal, and that's a pretty drastic example. They kind of grow things a lot. So you see epiphyseal fracture, separation of that goodness, I can't say it today. Wow. Anyways, so that the ball of the humor, the head of the humerus is no longer positioned like it should be. So we're going to be having examples of pathophysiology from the, or pathology from the anatomical perspective as we go through each section. So this is an example of what we're going to do. Now, one of the first things we have to do in studying anatomy is just get some basic terminology down, some relational terminology. I know you guys have probably all taken anatomy, so you guys should be pretty familiar with this, so I don't really need to belabor it a lot. It's just a reminder that you should know anatomical position, what that is. So here's your example here. And the different planes. So we have coronal plane cutting the individual left and, that's sagittal plane here. Left and right halves, coronal, front and back, and then transverse across the body axis. So just make sure that you are well familiar with these terms and can use them, because we'll be using them quite a lot in lab. Here's some additional terms. So we've got superior versus inferior, distal versus proximal, anterior, posterior, all of these terms. So any term that's on this slide, make sure you know what it means and in relationship to how we're going to study anatomy. So, we should know that the hand is distal to the shoulder. That's that kind of relational aspect to those terms. So make sure that you can use those, and because we're going to be using them throughout the entire semester. Some additional terms that are not really spelled out in your book as much: ipsilateral versus contralateral. Does anybody know what that means?
Ipsilateral, same side.
Mm-hmm. Contralateral is opposite side. Exactly. So make sure you know that one too. Now, going beyond what we have in the textbook, here I've got a slide with movement terms. This will be important, especially when we start talking about the muscular system and skeletal systems in each body region. Understand the function of those muscles. So each one of those muscles is going to function to cause one of these movements to happen. So know what is abduction versus adduction, what it would look like, flexion versus extension. Make sure you go through those. So, and again, you guys should be familiar with these already, so I don't need to belabor that too much. But just, again, go through, review these, make sure you know what they're talking about. Okay. Any questions before we move on? Okay, so the next section we'll talk about is some imaging techniques. And I'm not a radiologist. I don't tend to be a radiologist, but we need to talk a little bit about the basics of how these imaging systems work, because it can help you interpret the images a little bit better. So we'll talk about X-ray imaging systems. We'll talk about ultrasound, MRI. I'm not going to talk about these, partly because they are not quite as widely used, and partly because I don't know as much about them, so I don't want to sound like an idiot. So we're going to leave those. Just know that they exist, and that someday if you get into imaging to an extent that you're going to need to use these, at least you will have heard about them once before, at least. And then you'll also hear about them in your subsequent courses. So first of all, traditional X-rays. Does anybody know how an X-ray works? Just general, basic, one sentence. How do we get this image?
Radiation gets shot through the body and onto a plate, and then wherever the atoms don't go through, not atoms.
X-rays.
Yeah, X-rays don't go through, then it won't project on the plate, which makes it white because
Exactly.
of bone or dense mass.
Exactly. So X-rays are energy wavelength beyond ultraviolet, so pretty high energy waves. They penetrate soft tissue and air spaces fairly well, so that's why we see black lungs here. And then dense tissues, they don't penetrate as well, so the X-ray film does not get exposed as much. So, okay, so then let's just look at some anatomical structures, see if we can identify a few of these. What would this be here?
Well, spinal
There's several
column.
different things, right? So you can see the vertebral column right there, the sternum right here. What about this right here? What would you think that is?
Heart.
Heart, good. These guys? Ribs,
Oh,
yeah. Yeah, so the white part here, and then the whole lung here. Good, so, just, we want to know how to basically read an x-ray. We're not going to get into a lot of technical radiology because, they go to school for years for that, and I didn't. And then you can see some anomalies here, so really, really good identifying tumors lung tumors with x-ray because they have an opacity in the darkness of the lung. All right, so that is traditional x-ray. All right, we can do some extensions of traditional x-ray by adding contrast agents. So anything that's x-ray opaque so the x-rays are not going to penetrate through. This is an example here is of a barium contrast agent, so barium sulfate. And what they do is they give the patient an enema and then get the barium in throughout the colon, and then that allows them in the small intestines if they do oral administration, and that allows them to visualize the soft tissue, the gastrointestinal tract, because there's that layer of barium within that gastrointestinal tract. So we can use this traditional x-ray to even image some soft tissue stuff with the addition of this contrast agent. Okay, in addition to just like a barium type contrast agent for gastrointestinal use, we can also do some intra-arterial, intravenous contrast agents to look at arterial and venous structure. So in this particular example, I believe this is an iodine contrast agent, and you can see that you can see that there's just very clearly outlined blood vessels, and the way they do this is they take a pre-contrast X-ray image, infiltrate with the contrast agent, so iodine, and then takes a post-contrast image, and then they subtract those images from each other, so that all you're left with is the difference between the two, which is the contrast agent. So that allows you to visualize a lot more detailed structure, a lot more clear structure than you would normally be able to do with typical x-rays. They can also use this for studying the urinary tract because iodine is excreted through the urinary tract, so if there's a delay between administration and imaging, then they can use this to image what's going on in the urinary tract. Okay, any questions about this? Cool. Come on. There we go. Okay, so then we have additional X-ray based technology. This is CT scans. And what does CT stand for? Computerized or computed tomography. And does anybody know basic idea how this works?
Takes multiple transverse pictures of the body, depending on where you see it.
So it takes pictures all around the patient, and those are then put together into one single image. And what would be the benefit of that? What do you think? Why would this be a valuable imaging technique?
Well,
Okay, sort of. It's more to expand your grayscale and your detail. So we're taking a lot of 2D images that are all the way through the specimen or through the patient, and so it's not really going to give us good 3D imaging. It's more going to give us an easier way to identify structures because of an expanded grayscale. So here's a CT image, and if you had to guess, where would you guess that this is in the body? What level? This is
just right underneath the diaphragm.
Yeah, so it's going to be abdominal. So here we've got some intestinal structures here. And so you can see, as opposed to a normal X-ray image, you see that the bone structure, so here's a vertebra there, is a lot brighter, a lot more solid white, versus a much blacker black in air spaces, And then we see a lot more soft tissue structure. So we've got, like I said, intestinal tract, looks like some vessels of some sort there. So a lot more detail. So we can actually use this to image soft tissue without adding contrast agents. So very useful. Then we'll switch to a totally different style, ultrasound. And I'm sure we're all very familiar with ultrasound. So instead of using electromagnetic radiation, they're using sound waves. So basically it's like sonar, but the sound waves interact with the tissue and bounce back, and the timing in the bouncing back and the frequency of the reflected sound waves is interpreted by the computer to give us an image of, in this case, a fetus's head. And what's really cool, I've just been learning about this, is a newer, at least, technology called Doppler ultrasound, where they can use the Doppler effect, so the Doppler shift in the ultrasound, reflected ultrasound waves, sound waves, to measure movement, so like blood vessel fluid movement. I thought that was pretty cool. So make sure that you are familiar with Doppler ultrasound. Okay. Any questions so far at ultrasound? That one's a more familiar one for us, isn't it? Okay, this one is MRI. What does MRI stand for?
Magnetic resonance.
What?
Magnetic.
Magnetic
Imaging.
resonance imaging, right? It's actually an offshoot of imaging technique we use in science applications, nuclear magnetic resonance, NMR. But they changed the name slightly. But basically, it's going to we're going to have this. Wow, I just totally lost my train of thought. Okay, there we go. So we have a big coil here around the patient, and that coil is energized, becomes a huge magnet, and that then causes a change in the way the protons in the tissue are behaving. We call it all going to one spin. And if you want to understand a little bit more about that, this is a really great site here. It's got a really cool little tutorial where you can turn on the magnetic field, and it shows exactly what happens with the electrons. And actually, we can look at that real quick. Let's see. Turn this over. Okay, we'll go. See if it will do this for me. Okay, so this is the web page, and so this tutorial loads. Here we go. So this is their depiction of proton spin. Basically, it's just the way the protons are behaving. When you turn on the magnetic field, eventually it will turn on. Oh, is it not showing up? Well, that's not nice of it. Let's see. Does that work? They said it would work. Terrible. Okay, well, never mind. You can look it up on your own. Now how do I get rid of it? I tried it this morning and it worked. Well, whatever. Anyways. Okay, so so the magnetic coil aligns all of those atoms up in a particular way, and then by bombarding it with pulses of radio waves, so really long wavelength radio waves at certain frequencies, we can actually cause them to flip around in their orientation, and then when they flip back, they emit a radio wave, and so that is what the machine is detecting. And so you can see here the radio frequency coil here, and let me not obliterate the complete picture. And then those are picked up by the scanner down here and interpreted into the image. And there's several different ways they can do this, and these result in different weightings, different types of weighting. So we have like a T1 weighted scan. We can have a T2 weighted scan. We can have a diffusion. I can't spell, obviously. Weighted scan, and those will just highlight different aspects of the tissue. So here is a pelvic MRI here. You can see the vertebral column here, and what looks like bladder there. So in this one, fluids look like they appear fairly dark. So this would be a T1, I believe.
T2.
T2, thank you. No, fluid darkness is T1, right? You have your textbook there?
Yeah.
Totally, yeah, T2. Okay, good. So here's an example of each of these. So this first one here, which one is this?
T1.
T1, okay. And you can see we have dark fluid spaces here. See, these are the ventricles in the brain where you got cerebral spinal fluid, and we have a little bit lighter areas here, which is the more fatty portion of the brain, and like proteins and stuff like so tissues, soft tissues. Let's erase the fatty part. There we go. I love being able to draw these things. It's so much fun. So this is CSF, cerebral spinal fluid. Okay, here is a T2 weighted, and so then in these ventricles here, you see the fluid is now bright, and the tissue is now dark. So it gives us just a little bit different contrasts, and depending on what you're looking for. Okay, any questions about MRI? Yeah.
Are you wanting us to be able to differentiate between T1
Absolutely.
and T2? Okay.
Know the different characteristics. That is all in my lecture notes as well as in the chapter. So, okay, so those are different imaging systems. So know the basics. Know what's in my lecture notes. It's in the book. You don't need to be experts on it. You will get, I think, an entire course on this later on. So then we're going to transition into just doing some overviews of body systems that are distributed throughout the body. And the reason we're doing this is because we're studying regional anatomy for the rest of the semester. So we're going to just focus in on one part. So let's just go back and remind ourselves the overall structures of the body systems, the organ systems that are in the entire body. And let's see. There, okay, now I can see my clock again. So we'll start with the skeletal system, and skeletal system is made up of just basic guys. Bones, good. Okay, what else? What else? There's another type of structure in there.
Tendon?
Cartilage.
Oh, cartilage.
Very important part of the skeletal system. And as you see here, we've got the axial skeleton, which is everything but the limbs, and the pelvic and shoulder girdle. And then the appendicular, which are the upper arm shoulder girdle or lower arm pelvic girdle. So, basic reminder. Okay, so let's go back and do some basic histology for a minute. So cartilage, we have 3 different types of cartilage. Hyaline cartilage here, it's just got a bunch of little lacunae or holes within a protein matrix, and in those are the chondrocytes, so the cells that actually excrete this matrix called cartilage. And where would you find hyaline cartilage, do you think? It's a very, what's the word I'm looking for? Almost gel-like structure. Where would we guess to find that in the skeleton? Joints, exactly. This is the type of cartilage that covers the articular surface of joints. So the joint, part of the joint is actually interfacing with the other bone. So it's really important. And if you start losing that cartilage, what type of disease process is that? Arthritis, yeah. Okay, so this is joints. Okay, then we have fibrocartilage, and so we have our chondrocytes here. But in addition to the protein matrix, we have these collagen fibers, and they give a very fibrous feel to the tissue and makes it very, very strong. And can anybody tell me where these are useful? What structures are these useful in?
Tendons.
Hmm?
Tendons.
Yep, some tendons. What about intervertebral discs? So,
Oh.
yeah, that is really important. So, because it is tough
Hmm. Okay.
tissue.
Oh, I see.
Okay, and then finally here we have elastic cartilage, and this has a lot of fibers of elastin in it. Makes it elastic. Great. Where would this be important?
No.
Yep, nose. What else? And ears. Yep. What? There we go. I can spell. Good. So those are some places where these are very important types of cartilage. Okay, and then bone. We have bone. So bone is basically a calcified connective tissue. You just need to know basic structure. So we've got compact bone here. That's just this series of rings, basically, that contain a central artery, nerve, and vein to provide vascularization and innervation. And then we also have in the interior of the bone, we have spongy bone here, which is a more spider web-like network of what we call trabeculae here. Whoops, I'm going to cross it out. There we go. Trabeculae, basically struts, just providing a lighter interior and also a space for bone marrow to grow. So you don't need to know like the super details of these images. Just know the basic idea of what those tissues look like. So that when you get to this part of physiology, if there's something in the physiology lectures that this will be helpful with, we've at least gotten the basic idea. Okay. Also important for bone structure is this membrane here, the periosteum. So it's also highly vascularized, highly innervated, and provides the support and protection for the bone structure. And actually, if you strip the periosteum from the bone, that part of the bone is not going to be very healthy anymore and could deteriorate. Okay, any questions about that? All right, so clinical application. Finally, get off this dry stuff. So I think it's really interesting. So we can tell the skeletal age. Whoop. There we go. Age of an individual based on the amount of ossification of the bones. So during development, the fetal bones many of them are composed of what? Cartilage, right? And so then as the individual matures and grows, more of those bones become ossified. So we can see here, this is a young child here with quite a lot of cartilage and just a little bit of ossification in the hand and virtually no ossification in the carpal bones, so in the wrist. And as they age, you can see increasing amount of ossification in those carpal bones here until we get finally to a mature adult where we get complete ossification, and not only in the carpal bones, but also you see full ossification in all of the finger joints too. So we can tell skeletal age with that. And this can even be important because sometimes skeletal age doesn't always keep up or may go ahead of chronological age. So being able to identify this is going to allow us to say, okay, what kind of therapies do we need to consider for the individual to try to get their skeletal age and their chronological age to match, so we don't get Okay. Also, I said that we have marrow in the bones. So, does anybody know what's marrow important for?
Immunity, helping create red cells.
Mm-hmm. Yeah. So basically, it's the stem cells. It contains the stem cells that generate new white blood cells, new red blood cells throughout the life of the individual. There's two basic types of marrow. Red marrow here. And in an infant, most of the body's marrow is red marrow. And over time, some of it turns to yellow marrow, which you can see illustrated here in the femoral head. And it's located, so marrow is located in the center of long bones very often. We do have some marrow here in the vertebrae, in the femoral head. And again, really important for blood cell production. Okay, now what is a very well-known disease that affects bone marrow? Leukemia. And so that's when marrow is no longer behaving properly, and we can do a marrow transplant. The donor will give their marrow, transplant that into the patient's bones, and hopefully be able to at least have some normal functioning marrow in the system. All right. So another potential pathology is necrosis, so avascular necrosis of the bones. And this often happens, especially with elderly people, when they have a fracture of the femur that cuts the blood supply off to the femoral head. And you can see here's a normal hip here, nice round socket, nice round ball, looks like a good articulating joint. We also see a well-shaped gluteal muscle here, whereas on the other side, we see that there is some necrosis of the bone here. You see this irregular edge just kind of bouncing around all in there. And you no longer see a well-defined socket for the hip joint, and then some wasting of this gluteal muscle. So this is typical of an avascular necrosis. All right, and then finally, we want to talk about what happens when we have a reduction in the amount of calcium in these bones. What is a yeah, that's what I'm looking. Osteoporosis. I couldn't think of the word. Wow, still can't think of the word I was going to use. But anyways, it's osteoporosis. And there are a couple of injuries that are common. This is one of them. It's called a wedge fracture. And what happens is you have hyperextension of, this was a low thoracic high lumbar shot, x-ray. So you have hyperreflection of the spine. Actually, because there is less calcium then bone structure is more fragile. You actually have compression of this anterior side of the vertebral body, creating this wedge-shaped structure. So here you see a nice square, normal-looking vertebra. And here you see that anterior compression of the vertebral body because the bone's just no longer strong enough to withstand that stress. So that's very common in osteoporosis patients. And then here we also see actual slippage of the vertebral column when you get, again, lots of force gripping tendons and ligaments and no longer holding it in place. So you see, again, compression here of the vertebral body. Okay, questions about that? Cool. All right. So we got done a tad bit early. This is good. The class is over at 12:20, right?
Yeah.
I'm still getting used to my schedule. Okay, so in the last 5 minutes of class, any questions for me? Yes.
Is it possible for you to post slides before lectures?
Yes, I actually do have them posted. I just have to figure out how to make them visible to you guys. I'm still learning this Moodle thing. So they will be posted by the end of today, and then my plan is to post the week's lecture, all of the week's lectures, like on Sunday night. because that's when I do my practice on Sunday. So that way you have those for you for the whole week. Okay? Any other questions? Yes. Hang on, guys. I can't hear.
Your clinical examples that you're giving, should we know those specifically?
Yes.
What you're talking about?
Yes. Yeah, so any clinical examples, you should know cause and be able to identify it on an imaging technique or whatever. Okay? Any other questions? All right, we'll see you, is it tomorrow? Oh my gosh, tomorrow.
Yes.
Okay.
I remember